Welcome back. Now, the number of COVID-19 infections is on the increase. 25 people are now confirmed to have died, and there are 2,028 confirmed cases. Half of the deaths have been recorded in KwaZulu-Natal, with Gauteng being the epicenter of confirmed cases. So how is the province dealing with this? Joining us now via Skype is Gauteng Health MEC Bandile Masuku. MEC, good afternoon to you. Thank you so much for your time. Maybe let's start with the number of confirmed cases. Do you have an update for us? Yesterday, the health department said that we were looking at 2,028 cases in the country so far, but there hasn't been a breakdown. Where are we in terms of confirmed cases in Gauteng right now?
We are still on that figure that was given, and good afternoon to to your viewers. We are still on that figure. Remember that the only person who's authorized actually to give figures is the minister. And probably he will be able to give us the latest figures in the afternoon at around 6 o'clock. But we are still working on the figures that we released yesterday.
Yeah, and I understand, MEC, that that screening and testing program has already been rolled out. Alexandra being one of the townships where you started with the rollout. Please just take us through how many people have been screened and tested so far.
So far, we've done over 76,000 actually screening and over 800 tests. You will remember that we only test those who, through screening, are actually identified as individuals who are at high risk. So we have done actually pretty much well, but we still want to ramp up that particular actually program when we start the new week, this week, because the extension of the lockdown has given us more time to cover, particularly those who are known contacts.
MEC, a week or two ago, you were concerned about people that have tested at private laboratories, but that haven't been available to receive their results, and some of them had tested positive. We were looking at thousands of people that had tested, and they were not being traced. Where are we right now? Have you been able to trace most of the people that tested positive and those that had tested at private laboratories?
Yeah, we still have that big problem, particularly it's just in relation to how your service providers or your GPs and your private laboratories fill in the forms, because there's still a lot of forms that don't have enough information to be able to allocate and even locate those individuals. But we have put in systems and the technology to try and get a hold of them. And we are in the process of achieving that.
Yeah, and I mean, you can of course attest to this. You've been giving us that information, MEC, that Gauteng is currently the epicenter of the virus in the country. And I mean, I can imagine that more resources are needed to curb this virus within the country. But I just wanted to know more about when, perhaps, in terms of timeline, you're expecting that peak to take place within the province, and if whether or not you're ready as a province, honestly.
The whole important thing is about how we maintain our facilities and how we build the capacity. Over the past 3 months, we've been building the capacity, and in terms of the numbers that we are seeing currently, we are confident that we'll be able to cater for those patients. But looking at the modeling that we are doing, we are in a space that we are expecting the peak, I think, around September. But at that time, we'll be having enough capacity.
MEC, let's talk now about the relocation of residents from informal settlements. We've been hearing of this grand plan to de-densify crowded settlements, but no details really have been given. It seems the national government has left it to provincial governments to come up with a plan to roll out this program to de-densify some informal settlements. What information are you able to share with us? Have the areas, some informal settlements, been identified? Has land been identified where these people will be relocated to? Are they going to move as families? What details are you able to share with us this afternoon?
Yes, you would recall that as a province, we had already started with the rapid land release program, which now, because of the pandemic, will have to be hastened up and be actually speeded up, because we don't want to do temporary measures. If we actually populate some of the areas, it means that it must be a permanent solution, and it must give us some overall comfort about it. So as a Gauteng government, we are trying to combine the two. to make sure that those who we take out of these areas, they actually have actual proper settlements even after actually the pandemic.
Yeah, I want to move away, from what my colleague Clement Manyatela is talking about here, just in terms of communities and de-densifying these informal settlements, and perhaps move to the frontline healthcare workers. MEC, I'm sure you are much aware that the issue of PPEs is an issue not only in Gauteng but in the rest of the country, to a point where we've also seen the Department of Health saying medical masks would now only exclusively be designated to medical staff members, and the rest of the public can wear their cloth masks. But just in terms of, those PPEs, are they available? I mean, I understand that perhaps at this point there may be scars, but in terms of timelines, do you know when you can assure that all healthcare members in Gauteng have access to them?
Currently, we do have enough, and we are actually ramping up in terms of procurement, in terms of the stocks, because we want to have enough to a point where we are 6 months ahead, in terms of our stocks. But the most important aspect about this is just the appropriate usage of the PPE at a particular time, because not everyone would have the similar PPE. When you are in the ward or in the high care or ICU, you'd have a different PPE than when you are at the front line in terms of triaging at the reception area of our facilities. So we just also need, with the labor unions, go out and interact with our workers just to educate them about the appropriate use at the appropriate actual circumstances and situations. But currently, we are preoccupied with it, with the national minister. You have seen that we received some donations from different actual families, notably the Mutsepe actually Foundation. And I think we are quite comfortable at the moment, and we are continuously building up the stock.
MEC, I want to hear now, because often we don't hear how frontline government leaders are taking this new reality that is confronting us. I mean, day in, day out, as government leaders, you are on the streets at night, during the day, trying to come up and leading programs to combat this COVID-19 pandemic. Some people have families. I know you have a little child as well. How are you taking it as an MEC, really leading a program in the province of Gauteng, which is the epicentre? How are you balancing that between those government responsibilities and also making sure you get enough rest and you also dedicate some time to your family?
Yes, it's just one of those that we have to continue doing in terms of creating a balance, and just also ensuring that the lockdown regulations are enforced, and I think one of the upside about it is that you spend more time in the house, you spend more time with family, running after him and all that. And yes, you have to do and include some of your workout that you have to do now inside the house and inside the yard, and also a bit of reading, because there's a whole lot of reading that needs to actually take place. So yeah, it's part of everything, and I think the lockdown in itself has created enough space for us to be able to catch up with a lot of activities that we normally miss out. Absolutely.
And I suppose, my colleague Clement is also asking MEC, because we've seen you not only right now with the outbreak of COVID-19, but even during the holidays, the December holidays, where you would be on the ground with paramedics, ensuring that you attend to those that need medical attention. So we've also seen visuals of you attending to shifts in clinics as well as hospitals. And I suppose the question is, are you still doing that? And how is it then managing this fairly dangerous, pandemic or rather outbreak at this time?
Yeah, I think besides the caution, the precaution that I would have to take, I'm still part of the forefront. Even when we went to Alexander, I did a bit of actually testing and screening there, and also getting to get a hold of how the swab is done, the nasopharyngeal swab that is done. So it's part of it, and I think it's important that our healthcare workers must realize that as leaders, we are not only going to talk about actual situations, we are also going to make sure that we are part of them, we are in the forefront with them, so that we experience the same problems and challenges as they have.
All right, well, thank you so much. MEC for the Department of Health, Bandile Masuku, thank you so much for your time.
It's so